Hi everybody, welcome back to my YouTube channel. My name's Ashley Agan. I'm a board certified ENT, and I've had a lot of patients recently who are using a nasal spray that they think is just saline, so like a saltwater spray, all natural, just to kind of clean and rinse the nose, for example, for allergies or for a cold or something like that. And then upon further investigation, the spray actually has a medication called oxymetazoline. Now, oxymetazoline is the generic name for the brand name Afrin. And this medication, you have to be very careful when you use this medication because long-term use can result in a condition called Rhinitis Medicamentosa. So if you are using nasal saline, I want you to go find the bottle, turn to the back and look at the ingredients and make sure that it is what you think it is. Because I've had multiple patients who think they're just using saline and it turns out they're actually using oxymetazoline. Oxymetazoline works through vasoconstriction, meaning it squeezes the blood vessels down, which causes a reduction in nasal congestion in the nose. So it helps you breathe better almost instantly, like within seconds. Patients will be like, okay, like I can breathe a lot better. And it's really important to know if this medication is present or not, because oxymetazoline, though it works very well, it should only be used for short courses. So for example, I will usually tell patients 3 to 5 days max, and then stop. Take a little break before you use it again. So it's ideal for if you have a cold, because that's going to be a short course, if you have a sinus infection, if you are having a really bad exacerbation of your allergies. I will also use it sometimes when patients are flying. If they have trouble clearing their ears when they fly, they can use it before a flight. But long-term use causes this really horrible rebound congestion. So, for example, patients might be taking it for days to weeks, and then what they'll notice is that if they are due for their next dose, or if it's the next day, they have this really bad rebound congestion where their nasal congestion gets horrible, worse than it was in the first place. And then they'll use the medication, and then it will decongest the nose and things will feel better for a little while. And so the name for this is called Rhinitis Medicamentosa, but that's just a fancy way to explain this rebound congestion that happens when you stop the medication. And so if you are already in this boat where you are kind of stuck taking Afrin, a lot of times patients will come in and they'll have it kind of in their front pocket because they are using it so frequently that they need to have it on hand or else they're miserable. We will typically have a plan for helping patients to stop using that medication. First off is stopping it, so we'll throw it away that day. And then we will transition to using a nasal steroid spray. So this is going to be something like fluticasone, the brand name is Flonase, or a medication kind of that same class. Now that's going to help bring down inflammation in the nose. Sometimes I will also have patients take an oral steroid if we're really concerned about them not being able to breathe during this kind of almost like detox time while we let the system kind of come back to a normal state. But in general, eventually there will be this, I kind of warn patients that there may be this big rebound nasal congestion, but for the long term, stopping the Afrin is kind of the first step to getting them back to a normal baseline. And I think the oral steroids and the topical nasal steroids do help kind of get over that hump. And so very important, if you are using any sort of nasal spray, check the ingredients. Afrin or oxymetazoline is the generic name to look for. If that is in the nose spray, then you need to be very careful using that for longer than 3 to 5 days. Drop me a comment below. Let me know what you think or if you have questions.